And I call the honourable member for Holt.
Thank you, Madam Speaker. Madam Speaker, last Saturday I was proud to host the launch of Australians for Mental Health and a forum on youth mental health at Village Cinemas at Westfield Fountain Gate. This event was attended by nearly 200 people. This event would not have occurred without the support of Kirk Edwards, CEO of Village Cinemas Australia, and the wonderful staff of Village Cinemas Fountain Gate. They provided a beautiful VMAX cinema upon request for no charge to benefit the community, and they provided extensive support before and during the day. I also wish to thank Leanne Petrides, Executive Officer of the Cranbourne Information Support Service, for her impressive work in emceeing this event and appreciating the sensitivities that occur when holding a youth mental health forum. She did a wonderful job. This forum and launch occurred because of the strength, the tenacity and the desire of our young people in the city of Casey. So often our young men and women in our region read about themselves in a negative light. So rarely do they hear about the great works being done by such men and young men and women like Danny Rothwell, Alicia Keane, Jake Donewood, Amanda Karen and others. These young people have literally started a national conversation and a movement. They have started a campaign which is nationally empowering our youth in local and national efforts to reduce the risk of youth depression and other mental health issues in our community. Since our local summit on youth suicide in 2012, collectively we've been responsible for ensuring that there was a headspace built in Dandenong and a new headspace which will be up and running in the Fountain Gate precinct by the end of the year. Additionally, there will be an early psychosis prevention centre rolled out in both of these locations shortly. But we know there's much more to be done, both locally and nationally, to ensure that mental health services are available to all Australians. At our forum, we were proud to partner again with Professor Patrick McGorry from Origin Youth Health, who launched Australians for Mental Health. Australians for Mental Health is a new mental health advocacy group and campaign similar to GetUp. This innovative advocacy campaign, if successful, will change the face of mental health funding in this country and will reduce the stigma that still clings to discussion about mental health in our community. Australians for Mental Health have several goals that include the voices of Australians affected by mental ill health to be heard and responded to, equal access to and quality of mental health care as physical health care by 2020 through transformational reform and investment, a reduction in the suicide toll to 75% of its current rate by 2016 and 50% of its current rate by 2020, an increase in annual funding for mental health to 10% of the total health budget by 2016 and to 13% by 2020, improved access to mental health care from a level of 40% in 2008 to 60% in 2016 to 80% by 2020. Australians for Mental Health is headed by Professor Patrick McGorry, who at the forum noted that mental illness poses by far the greatest threat amongst all non-communicable diseases to health, happiness and economic productivity. He said, "We want to encourage the community to make its voice heard on the need for mental health across the whole lifespan." We know, Madam Speaker, that after the game-changing Burdekin report, that mental health treatment devolved from being treated primarily at an institution to being treated in the community. But we also know that mental health service providers have never been appropriately funded by any government to provide that service to the community. We know that in Australia, governments spend around 7% of their health budgets on mental health, when other comparable first world countries spend up to 14%. We also know that we continue to underfund mental health research in this country, even though we have some of the best mental health researchers in the world. Now, I believe that the discussion started by our young people in the city of Casey and the launch for Australians for Mental Health will be a game changer. I believe that due to the efforts of Professor McGorry over many years and so many others in the mental health profession, that mental health, its funding, its discussion, its treatment and prevention services will truly have its day. I wanted to thank our principal partners for the event that included Headspace, Origin Youth Health and South Eastern Melbourne Medicare Local for their support, and I wanted to thank the people from the city of Casey who attended the forum. But primarily I wanted to thank and acknowledge those young people and the people that sat in the audience, many that had been affected by the profound loss occasioned by suicide. And they have decided to transform their grief into advocacy and illuminating the need for prevention and treatment services for young people in our community. I admire the bravery of many of the people who speak here in that audience, and I admired their commitment. We have to make sure as Professor McGorry said, that the discussion about adequate services and treatment for mental health and illness in this country has its day.
The honourable member's time has expired.